Hi, and welcome to Health Matters on Charities Vitality Vault. Diabetes, in short, DM, often refers to a silent disease. It is a silent disease because most people live with this condition without knowing, yet it is one of the fastest growing health conditions which affect individuals globally. According to statistics, the number of cases of DM increases significantly day in, day out. That's why it is very, very crucial for us to have inside knowledge on this topic, which will enable us to navigate the year 2026 with good life and a vibrant life. So with me today, I have a guest speaker today. I will be introducing him to you guys. Guys, are you with me? Stick around as I come back to introduce you my guest speaker tonight. Hi and welcome back to my channel. I am privileged to introduce to you my guest speaker tonight. He is one of the emergency departments in charge in one of the special hospitals in Kumasi. He is in a person of Ike Opoku. Please help me in giving a warm welcome to my guest speaker. Hi Ike.
Hi Charity.
Good evening. How are you?
My God,
It's been a long time.
Sure.
Genuinely from my heart, you look great tonight.
Thank you very much. You're looking awesome too.
Oh, thank you.
You're welcome.
I believe you are fully pumped up for today's topic, right?
Very well prepared.
All right, thank you so much. I think 4 months ago, I came across, I don't know whether it's a paper in Ghana here, one of the teaching hospital that is called that's DM cases are increasing significantly here. And then you and I can testify, we are in the health sector, you know that, right? So that is why we are here today, to enlighten ourselves and to learn something, most importantly. So when we say diabetes, DM in short, what are we talking about? To the layman, what are we saying? What are we looking at?
Okay. Thank you very much once again.
You're welcome.
I'm very glad to be on the show to educate the public on diabetes.
Thank you.
As you stated earlier on, it is increasing. So there's a need to educate the public for them to be aware of it and then put measures so that they can reduce the number of the cases occurring. So today we'll be educating or learning something about diabetes. Diabetes mellitus is a group of metabolic disorder or diseases, which is characterized by elevated glucose in the blood. How come the sugar or the glucose is elevated? One, it's a result of lack of insulin production, or not enough insulin production. It's either the insulin is not producing at all, or it's producing but it's not enough. Or it is producing but the cells are not able to take up the insulin. Are you getting it? So for every individual must eat. You have to get energy, and the energy is getting from eating. So when you eat, the sugar in the food must enter into the blood, and when it goes into the blood, it is termed as glucose. This glucose must enter into the cells or the tissues of the body so that you get energy to do your daily activities, walking, doing everything. So without the glucose entering the tissues or the cells, you can't get the energy. So the glucose must enter into the cells, not in the blood. It shouldn't be in the blood, but rather it must be in the cells. But it will go into the cells with the help of insulin. So without the insulin, the glucose cannot enter into the cells. Do you understand?
Yes.
So the insulin is produced by the pancreas. The pancreas, the beta cells in the islet of the pancreas.
This is an organ?
It's an organ in the body, which produces the insulin, and the insulin will take the glucose in the blood into the cells. So in the process, or in case when this pancreas is damaged or destroyed, there will be no insulin production. So meaning the glucose will be in the blood. Meanwhile, it must enter into the cell.
Sure.
So when there's no insulin production, it's one of the causes. And again, there may be insulin production, but it's not enough to carry most of the glucose into the cells. It's another cause. And one cause is that there will be enough insulin production, but the cells is refusing or is neglecting or rejecting the action of the insulin. In that term, we call it diabetes mellitus. I get it. So when you eat, the sugar will go into the blood, termed as glucose. The glucose must enter into the cells for you to get energy to perform any activity you want to perform. But the glucose can enter into the cells with the help of insulin.
Okay.
So this insulin will take the glucose and push it into the cells for you to get the energy. I get it. So when we have fault the pancreas and it is not able to produce the insulin, for the insulin to take the glucose into the cells, is termed as diabetes.
Okay.
In another case, your pancreas will be working properly, normally, but it is producing the insulin all right, but the insulin is not able to take the glucose from the blood into the cells because the cells are rejecting the action of the insulin. I get it.
Wow.
So in that term, we've got that sort of diabetes because all the sugars or all the glucose are remaining in the blood, meanwhile it must enter into the cells. That's termed as diabetes.
So do you have types? Do we have various types of diabetes?
Sure, we have types. We have various types of diabetes. Okay. But today we'll be looking at maybe 4 of them.
Really? There are 4? There are more than that?
There are more than that.
Okay.
So
what are they?
1, we have type 1 diabetes, we have type 2 diabetes, we have gestational diabetes, and we have diabetes associated with other conditions.
So in short, can you explain that to us?
Sure.
Yes.
So in type 1 diabetes, let's listen well. In type 1 diabetes, here the pancreas, which is supposed to produce the insulin, is destroyed. It's damaged.
Okay.
So the pancreas cannot produce the insulin.
Okay.
The pancreas cannot produce the insulin. So in type 1, there is no insulin production, or there is few or not enough insulin production. So this insulin cannot take the glucose in the blood into the cells.
Sure.
I get it.
Yes.
So in type 1, there's no insulin production or not enough insulin production. In type 2, there's insulin production, there's adequate insulin production, but the cells are quitting the effect of the insulin production. So here there's insulin production, but there's insulin is not able to take the glucose in the blood into the cells.
Okay.
Because the cells are refusing. The cells are not allowing the insulin to enter it.
Oh wow.
That's the type 2.
The type 2.
So the type 2, there is insulin production.
The problem is
problems are the cells. The cells are refusing.
Type 1, the problem is that
there is no pancreas destroyed. There's no insulin. There's that difference between the 2.
Okay.
Type 1, there's no insulin. Type 2, there's insulin.
Oh wow.
Let's go to the third one. We have gestational diabetes or pregnancy-induced diabetes.
Oh wow, pregnancy.
Yes.
Okay.
So most women, those who are pregnant, when during their gestational period, they get diabetes.
Oh.
How does it come?
Okay.
During the pregnancy, we have something called placenta. This placenta nourishes the fetus.
Okay.
It gives the fetus nutrients and then blood for the fetus to grow well. So during that, they have some hormones which help this placenta to develop well.
Okay.
Some of the hormones are estrogen, cortisol, and the rest. These hormones, which are produced by the placenta, it will inhibit or reduce the effect of the insulin.
Okay.
So they are not allowing the insulin to work properly.
Okay.
So in that case, the insulin cannot take the sugar or the glucose in the blood into the tissues or the cells. So thereby leading towards gestational diabetes. And we have another one which is associated by other conditions.
Okay.
Other conditions like pancreatitis. When you have inflammation of pancreas continuous or chronic pancreatitis, it can damage the cells.
Okay.
As I said earlier on, the cells are called beta cells in islet of Langerhans.
Okay.
These are the cells that are found in the pancreas, which produces the insulin. So when we are having frequent infection of the pancreas, these cells would get destroyed or damaged. So as a result, they cannot produce insulin, thereby leading into diabetes. When we have tumors of the pancreas, it can also destroy the cells, thereby inhibiting the production of insulin. I get it. And when you have cervical removal of the pancreas, when the pancreas removed, you can't get any insulin from it. So therefore, the glucose will remain in the blood, leading to diabetes.
Wow. Thank you so much. Because of our time, we will want to end here, viewers. So if you have any question, you can DM us. So thank you so much for watching too. Do remember to click on the video, make sure that you subscribe, then bring in your comments and then we answer them for you. Thank you so much. We're ending here because of our time. If you want to continue to enjoy this video, please check our next video.